Hello, everyone. As has been commented so often through the past many months, we are living through unprecedented times. Thanks to all of you for your commitment to keeping our communities safe through practicing social distancing, wearing masks, great hand washing, and all the other infection control procedures at your disposal. We've reached a new milestone in this journey. The FDA has approved the use of the COVID-19 vaccines. However, we know that many of you have questions and concerns regarding the safety and efficacy of these vaccines. To help answer your questions, we've asked our medical consultant, Dr. James Avery, to provide some facts around the new vaccines. Dr. Avery is a board-certified internal medicine, pulmonary, hospice, and palliative medicine physician, and he is a certified nursing home medical director. He has worked with Aegis Therapies throughout the pandemic to help us keep our staff and communities safe for the past year. As always, thank you, Dr. Avery, for your time and expertise.
This is probably the most important lecture I've ever given. I've given thousands probably of lectures to medical students, residents, interns, physicians, nurses, but we're in the middle of a once-in-a-lifetime pandemic. And the information I'm going to give you now can save your life, the life of your loved ones, your colleagues, people you go to church with, and it can help our country recover. Because what is the key ingredient to ending the pandemic? It's a safe and effective vaccine, one that is developed and launched well and accepted by the public. And you can trust this vaccine. That's one of my main messages here. The FDA has gone to unusual lengths to reassure people. You see, they almost 150,000 people have been involved in trials so far over the 5 different vaccines that are out there. And it can't just show, antibodies. It has to show fewer infections. It has to show that it's been clinically effective. And they've looked at safety issues for at least 2 months after the vaccine was given, while really most side effects occur within 6 weeks. And they've been transparent. You can watch all of the FDA's discussions online. It's live streamed. I mean, it's pretty amazing how the FDA is completely free of any political meddling. It would be obvious. So when we look at all these studies that Pfizer has done with this vaccine and Moderna, we'll look at Pfizer basically. You have about over 30,000 who got a placebo. They got the fake one. This is Pfizer and Moderna combined. And then you have about 35,000 folks who have gotten the vaccine, and they compare them. It was 20 times the difference. Meaning 20 times more people who got the placebo shot, the fake shot, got infections, and even more so, got serious infections. So there's no question about the efficacy. It's almost astounding. In a typical flu season, the flu season vaccine is about 40% effective. On a good year, maybe 60%. On a bad year, 20%. These vaccines, both Moderna and Pfizer, are 95% effective. Astounding. And side effects have been minimal. Now, there's lots of little side effects. That means the vaccine's taking effect. Maybe a little muscle aches, fever, that type of thing. But as far as serious adverse effects, they have been very rare. So we have a safe and we have an effective vaccine, but there are plenty of reasons to get vaccinated besides helping to end this pandemic. Yourself, your loved ones, your friends, your colleagues, your patients. It's going to be a travel ticket in a way to get on airplanes possibly. And it's completely free, paid for by the federal government. And it's extremely important for those that work in nursing homes that are seeing nursing home patients. Over 100,000 people have died in nursing homes so far in the U.S. 40% of all deaths have occurred in nursing homes. If this vaccine is taken by folks as soon as it's available, we can save probably 10 to 20,000 lives. Now let's get more personal. My mom is 90 years old. She lives in Florida. I want her to be the first person online to get this vaccine. I love my mom. I am convinced this vaccine is the right thing to do, and I would love to be second online. So what's the key ingredient to to getting over this pandemic for our country, for your nursing home, and for you? It's a safe and effective vaccine, which we have, and then it's you, the decisions you will make and the decisions you will decide in the next few days and weeks.